Can back pain be a symptom of prostate cancer? Advanced prostate cancer can sometimes cause chronic back pain. This usually happens in the later stages when cancer spreads to the bones in the spine. The prostate is a walnut-sized gland that sits below the bladder and wraps around the urethra. This gland is part of the male reproductive system and is involved in the production of semen. In advanced prostate cancer, cancer cells spread beyond the prostate to other parts of the body. These cells usually spread to the bones first. Doctors refer to this as bone metastasis. If the spine is affected, a person may experience back pain. This video looks at the link between back pain and prostate cancer. It also examines the options for pain relief. There can be a connection between back pain and prostate cancer, but back pain alone is not necessarily a sign of the disease. Back pain is most likely to relate to prostate cancer in the later stages if cancer spreads to the bones. Metastatic prostate cancer most often reaches the spine, ribs, and hips. This usually occurs in stage 4 prostate cancer and it can cause pain. Bone metastases affect as many as 6% of males with prostate cancer. Individuals with chronic back pain that have no obvious cause should see a physician for an evaluation. Symptoms: back pain caused by prostate cancer that has spread to the spine may have some of the following symptoms depending on where the cancer is located. Pain increases with movement. Pain is worse at night or when lying down. Stiffness in the back or neck. Difficulty walking. Less sensitivity to pain, cold and heat. Numbness, weakness or tingling in the legs or arms. Risk factors. The primary risk factor for developing back pain is if cancer progresses and metastasizes to the bones, particularly in the back. In addition, one of the most significant risk factors for prostate cancer in general is aging, which can also contribute to back pain. According to the American Cancer Society, this type of cancer is rare among males under 40. About 60% of cases happen in males over 65. The average age at diagnosis is around 66. The disease is less common in Asian Americans and Hispanic or Latino males than in non-Hispanic people who are white. Having a family member with the disease may also increase a person's chances of developing it. Other risk factors for prostate cancer may include an unhealthful diet, obesity, exposure to certain chemicals. Other causes of back pain. Back pain, particularly in the short term, is a very common medical complaint. Possible causes can include strains or sprains, overexertion, injuries, damaged, ruptured or deteriorating disc in the spine, spinal stenosis, pressure on the spinal nerves, sciatica, abnormalities of the spine such as scoliosis, arthritis and other inflammatory diseases, kidney stones, infections, abdominal aortic aneurysms. However, if a person's backache is chronic and they also have prostate cancer or are more at risk for developing it, It is a good idea to see a doctor as a precaution. What are the other symptoms of prostate cancer? Prostate cancer usually has no early warning signs. Because of this, many doctors and health authorities recommend screening males at risk. When prostate cancer does cause symptoms, they may include a frequent urgent need to urinate, nocturia or needling to urinate frequently during the night, reduced urine flow, trouble starting or stopping the flow of urine, pain with urination or ejaculation, blood in the urine or semen. However, this can also be symptoms of other conditions including benign prostatic hyperplasia, which is an enlargement of the prostate and is very common in older men, prostatitis, which is inflammation of the prostate. Neither of these conditions involves cancer, but it is still important to see a doctor for evaluation and treatment. When to see a doctor? Anyone who has already received a prostate cancer diagnosis and begins to experience recurring back pain should see a doctor as soon as possible. Unexplained back pain can indicate that cancer has spread. People with back pain who are concerned about the risk of prostate cancer should speak to their doctors. Prostate cancer often causes no symptoms in the early stages. According to the National Cancer Institute, the most common method of detecting this cancer in the United States is prostate specific antigen or PSA screening. Levels of this protein increase when the prostate is dealing with irritation, swelling, or the growth of cancerous cells. The US Preventive Services Task Force recommends that males ages 55 to 69 discuss the risk and benefits of prostate cancer screening with their doctors.